Welcome to today's video, where we'll uncover the 7 silent stroke symptoms you may experience a month before it happens. Did you know your body often gives subtle yet vital warning signs before a stroke? Recognizing these early symptoms can be life-saving, helping you or your loved ones seek immediate medical attention and prevent a major health crisis. Why is this so crucial? Well, strokes can affect anyone, regardless of age, gender, or how healthy you seem on the outside. Cardiovascular diseases, including strokes, are rising globally and have even become a growing concern for younger individuals. In the United States alone, more than 795,000 people experience a stroke each year, claiming the lives of nearly 159,000 annually. That's why it's vital to recognize the signs early and act fast. Today, we'll break down the 7 key symptoms that could appear up to a month before a stroke strikes, and we'll discuss how to prevent it. Stick around because this information could save your life or the life of someone you care about. If you find this information valuable, don't forget to leave a like and subscribe. It takes just a second, but it helps us reach more people with these essential health tips. And if you have any experiences or recommendations, I would love to read them in the comments. Now let's get started. 1. Persistently high blood pressure. Persistently high blood pressure, also known as hypertension, is a serious condition that significantly increases the risk of a stroke. Blood pressure measures the force exerted by blood against the walls of the arteries. When this pressure remains consistently high, it can damage blood vessels over time, leading to narrowing, weakening, or even rupture. This damage heightens the likelihood of both ischemic and hemorrhagic strokes. In ischemic strokes, high blood pressure may cause arteries in the brain to narrow or become blocked, reducing blood flow and depriving brain cells of oxygen. On the other hand, a hemorrhagic stroke occurs when prolonged hypertension causes a blood vessel in the brain to burst, leading to bleeding and increased pressure on brain tissue. Managing high blood pressure is crucial for stroke prevention. This includes maintaining a healthy lifestyle with regular exercise, a balanced diet low in salt and saturated fats, and stress management. Monitoring blood pressure regularly and adhering to prescribed medications are also essential steps. Hypertension doesn't discriminate. It can affect anyone, regardless of age or health status. Recognizing and controlling persistently high blood pressure can significantly reduce the risk of a stroke and other cardiovascular complications, making it a vital aspect of long-term health. If you're going to take note of this symptom comment, pressure. 2. Unexplained. Excessive fatigue. Unexplained. Excessive fatigue can be an early warning sign of a stroke that often goes unnoticed. While fatigue can result from various factors like lack of sleep, stress, or physical exertion, persistent and severe tiredness that doesn't seem to have an obvious cause should not be ignored. This type of fatigue may indicate disruptions in the brain's blood supply, potentially caused by narrowing or blockage of arteries due to atherosclerosis or small blood clots. Fatigue linked to stroke risk often arises from reduced oxygen and nutrient delivery to the brain. This can impair cognitive function and physical energy, making even simple tasks feel overwhelming. In some cases, this excessive tiredness precedes a transient ischemic attack, TIA, often referred to as a mini stroke. A TIA is a temporary interruption of blood flow to the brain, causing symptoms similar to a stroke but without lasting damage. However, it serves as a critical warning sign of an impending stroke. If you or someone you know experiences extreme unexplained fatigue, it's essential to consult a healthcare provider immediately. Identifying and addressing potential causes, including underlying cardiovascular issues, can help prevent a stroke and safeguard overall health. Don't ignore what your body might be trying to tell you. Comment, excessive fatigue if you're now well aware of this symptom. 3. Vision problems. Sudden vision problems can be a critical warning sign of an impending stroke. Blurred vision, double vision, or even partial vision loss should never be dismissed, as they often indicate circulatory damage in the brain. These symptoms can result from a transient ischemic attack, TIA, or a stroke, both of which impair blood flow to the brain and eyes. A stroke may block an artery supplying oxygen and nutrients to the eyes, leading to sudden and severe changes in vision. When blood flow is restricted, the optic nerve and surrounding tissues are deprived of essential nutrients, which can cause visual disturbances. In ischemic strokes, a blockage in the arteries prevents adequate blood supply to certain areas of the brain responsible for vision. This results in symptoms like difficulty focusing or partial blindness. On the other hand, hemorrhagic strokes caused by bleeding in the brain may also lead to pressure on visual centers, causing similar problems. Ignoring these signs can delay necessary medical attention, increasing the risk of permanent damage. If you or someone you know experiences sudden changes in vision, seek medical evaluation immediately. Early intervention can make a significant difference, potentially preventing a full stroke and preserving quality of life. Comment blurred vision if you have taken note of this symptom. 4. Severe sudden headaches. Severe sudden headaches can be a crucial warning sign of a stroke, especially when they appear unexpectedly and without a clear cause. While not all headaches indicate a stroke, those that are intense and sudden in nature should never be ignored. These headaches may signal underlying issues such as a transient ischemic attack, TIA, an ischemic stroke, or even a hemorrhagic stroke. In ischemic strokes, where blood flow to the brain is obstructed, headaches may occur due to reduced oxygen supply. These headaches are often described as severe and persistent. However, the most alarming type of headache is associated with hemorrhagic strokes caused by bleeding within the brain. This bleeding increases intracranial pressure, leading to what many describe as the worst headache of their life. A sudden and intense headache could also indicate a brain aneurysm, a dangerous condition where a weakened blood vessel bursts, resulting in bleeding in or around the brain. Such headaches are often accompanied by symptoms like nausea, vomiting, or loss of consciousness. If you or someone you know experiences a sudden, severe headache, seek immediate medical attention. Early detection and treatment are essential to preventing severe complications and ensuring the best possible outcome. Common sudden headaches, if you're now aware of this symptom. 5. Numbness or weakness in the extremities. Numbness or weakness in the extremities, especially when isolated to one side of the body, is a significant warning sign of an impending stroke. This symptom occurs when blood flow to a specific area of the brain is compromised. The result is a temporary or permanent disruption in the brain's ability to control movement and sensation. This symptom is often associated with transient ischemic attacks, TIAs, sometimes called mini strokes. During a TIA, blood flow to the brain is temporarily blocked, causing symptoms such as sudden weakness or numbness in an arm, leg, or even one side of the face. These episodes can last from a few minutes to several hours and typically resolve without permanent damage. However, they serve as a critical warning sign of a potential full-scale stroke in the near future. Ignoring this symptom can be dangerous. Sudden weakness or numbness is not normal and should never be attributed to fatigue or minor health issues. Immediate medical evaluation is essential to determine the underlying cause and begin treatment. Recognizing this symptom early can be life-saving, preventing severe brain damage and improving recovery outcomes for stroke patients. Comment, weakness, if you now understand this warning sign. 6. Speech difficulties. Speech difficulties, also known as aphasia, are a critical warning sign of a potential stroke. This symptom often manifests suddenly and can include slurred speech, trouble forming words, or difficulty understanding others. These impairments occur when blood flow to the areas of the brain responsible for language is disrupted, resulting in temporary or permanent communication challenges. For someone experiencing a stroke or transient ischemic attack, speech difficulties can range from mild hesitation to a complete inability to articulate thoughts. They might struggle to find the right words, form coherent sentences, or interpret simple instructions. This sudden breakdown in communication often confuses both the individual and those around them. It's important to recognize that these speech issues may not always be accompanied by other noticeable symptoms. However, they should never be ignored or dismissed as minor. Immediate medical attention is essential, as early intervention can prevent further brain damage and increase the chances of recovery. Time is critical in addressing stroke symptoms. If you or someone you know suddenly exhibits speech problems, it's a clear signal to seek help right away. Acting quickly can mean the difference between recovery and long-term disability, or even saving a life. Comment speech problems if you have taken note of this symptom. 7. Neurological symptoms. Neurological symptoms are often a warning sign of an impending stroke, and their sudden appearance should never be ignored. These symptoms may include memory problems, difficulty concentrating, loss of balance, or sudden episodes of nausea and vomiting. Strokes affect the brain, which controls every aspect of our body, and disruptions in its normal function can cause a wide array of seemingly unrelated issues. Memory loss, for instance, can make it hard to recall recent events, while trouble balancing or coordinating movements might lead to stumbling or falls. These signs can appear subtly at first, often mistaken for fatigue or stress, but they can escalate quickly. Some individuals may also experience dizziness or vertigo, which could point to reduced blood flow to specific parts of the brain. It's important to note that many conditions, such as migraines, seizures, or low blood sugar, can mimic these symptoms. However, if they occur suddenly, are unexplained, or persist, it's crucial to seek medical evaluation immediately. Neurological symptoms are often the body's way of signaling that something is seriously wrong. Early recognition and prompt action can be life-saving. If you or a loved one notices these signs, don't hesitate. Consult a healthcare provider without delay. Comment, memory loss if you are now aware of this symptom. Now, let's understand the difference between ischemic and hemorrhagic strokes. Understanding the two main types of strokes can help you identify them more effectively. Ischemic stroke, it occurs when a blood clot blocks blood flow to the brain, depriving it of oxygen and nutrients. Causes include atherosclerosis, narrowed arteries, and embolisms, clots from other parts of the body. This type is the most common, accounting for 85% of strokes. Symptoms include weakness, confusion, and speech difficulty. Immediate treatment is essential to restore blood flow and minimize damage. While hemorrhagic strokes happens when a blood vessel bursts, causing bleeding in or around the brain. Common causes are high blood pressure and cerebral aneurysms. Symptoms include severe headaches, nausea, and loss of consciousness. Though less common, hemorrhagic strokes are more severe and require urgent medical care to control bleeding and reduce pressure. Both are medical emergencies requiring immediate attention, so act fast if you suspect either. Here's how to prevent a stroke. To prevent a stroke, maintain a healthy lifestyle. Control your blood pressure and cholesterol levels, manage diabetes, and maintain a healthy weight. Exercise regularly, eat a balanced diet rich in fruits, vegetables, and whole grains, while avoiding processed foods and excess salt. Limit alcohol consumption and quit smoking. Prioritize good sleep and reduce stress. Regular checkups with your healthcare provider can help monitor risk factors and catch potential issues early. These proactive steps can significantly lower your chances of having a stroke. If this video was helpful, please give it a thumbs up, share it with your friends and family to spread this vital information. And if you're new here, don't forget to subscribe to our channel and hit the notification bell so you never miss out on our future videos. Did you know about these silent stroke warning signs? Share your thoughts in the comments below. Thanks for watching, and we'll see you in the next video. Stay safe.